In this video, I will be discussing how to interpret confidence intervals and p-values. It is important that as healthcare providers, you are able to understand both p-values and confidence intervals in order to be able to use the literature and apply published results to the care and treatment decisions of your patients. Hypothesis testing using p-values and estimation using confidence intervals are two statistical frameworks that pertain to the precision of the observed magnitude of a treatment effect coming from a randomized trial. The purpose of inferential statistics is to designate how likely it is that a given finding is simply the result of chance. When we do a study, we're trying to use data collected on only a sample of the population of people affected by disease or by an exposure. We then use data from the sample to make inferences about the relationship between exposure and disease that will be true for the whole population. As you might expect, this can be problematic. The characteristics of the people included in your sample might change should you select a different group of people from the same population, because people are selected more or less at random from the larger population. We can speculate that there's a possibility your study results are different from what you would get if you studied the entire population, and that this difference is due to random chance. Therefore, we need a way to estimate how your small sample represents the larger population. This is estimated by using the amount of variation that you would have observed within your study sample, assuming that the variation between subjects will be true for the whole population. When you perform a hypothesis test in statistics, a p-value helps you determine the significance of your results and provides a criterion for making decisions about the null hypothesis. All hypothesis tests ultimately use a p-value to weigh the strength of the evidence, for instance, what your data are telling you about the population, and quantify the chances that a decision to reject the null hypothesis will be wrong. The p-value is a number between 0 and 1, interpreted in the following way. A p-value of less than 0.05 means that it is unlikely that your findings are due to chance. When a p-value is greater than 0.05, it could mean that the results may be due to chance. P-values very close to the cutoff are considered to be marginal and can go either way. One of the many problems with null hypothesis significance testing is that it encourages dichotomous thinking. Either an effect is statistically significant or it's not. The p-value does not tell us clinical significance or likelihood of benefit. Using a p-value to merely test if there's a significant difference between groups does little to progress science. Surely, a more informative, interesting question to ask is, how big is the effect? Or, how strong is the relationship? Confidence intervals give us a method for answering such questions. A good way to think about confidence intervals is as a range of plausible values for the population mean, or another population parameter such as a correlation, calculated from our sample. A confidence interval with a 95% confidence level has a 95% chance of capturing the population mean. Technically, this means that if the experiment were repeated many times, 95% of the confidence intervals would contain the true population mean. Confidence intervals not only give the reader an easy-to-interpret range of estimates of the population mean, they also give information about the precision of an estimate. Think of precision as a measure of uncertainty associated with our estimate. An uncertain estimate using a 95% confidence interval would be quite wide, whereas a more certain estimate using a 95% confidence interval would be much smaller and therefore more precise. Confidence intervals can be used to test hypotheses when necessary. Any point outside of the 95% confidence interval can be used as support in rejecting the null hypothesis at 0.05 two-tailed. If you widen the confidence interval to 99%, any point outside of the interval implies statistical significance at p less than 0.01 two-tailed. You can easily estimate a p-value from a confidence interval. However, you cannot estimate a confidence interval from a p-value. Essentially, confidence intervals offer everything that p-values offer and far more. Here are some common misconceptions about confidence intervals. 1. Definitional misconceptions. Confidence interval is an estimate of a plausible value for the population mean. It is not a range of plausible values for the sample mean, a range of individual scores, or a range of individual scores with one standard deviation. 2. The overlap misconception. The overlap misconception is a belief that when comparing means for two independent groups, the means are statistically significantly different at p less than 0.05, when the 95% confidence intervals about the means are just touching. In actuality, confidence intervals for independent groups are at p equals approximately 0.05 when they overlap by about a quarter. When the 95% confidence intervals are just touching, no overlap, p equals approximately 0.01. This, however, does not apply to repeated or paired design statistics. For repeated or paired designs, you should create a confidence interval around the difference between the groups. And lastly, the confidence level misconception. Some believe that a 95% confidence interval for an initial experiment has a 95% chance of capturing the sample mean for a repeat of the experiment. This would only be true if the initial sample mean landed directly on the population mean. In fact, the average probability of the first 95% confidence interval capturing the next sample mean is around 83%. Here are some tips for interpreting confidence intervals. 1. Take note of what is most important to the study. What is the magnitude of the effect? Don't just focus on the statistical significance. Ask yourself, is the effect practically important? 2. How precise is the confidence interval, and what does this tell us about the design of the study? A precise confidence interval can give a very good estimate of the population parameters. 3. The center of the confidence interval, which is the sample mean, is the most plausible value for the population mean. The ends of the confidence interval are less plausible values for the population mean. 4. When using repeated measures or paired group design, do not compare the confidence intervals of the group means or of the pre-test and post-test scores, because there will be no meaningful interpretation. Instead, use a confidence interval around the mean difference. And lastly, 5. As discussed, p-values can be estimated from the graphs of the confidence intervals of two independent sample means. If the confidence intervals overlap by half a margin of error, then the p equals approximately 0.05. When they are just touching, the p equals approximately 0.01. The essential differences between p-values and confidence intervals are as follows. 1. The advantage of confidence intervals in comparison to giving p-values after hypothesis testing is that the result is given directly at the level of data measurement. Confidence intervals provide information about statistical significance as well as direction and strength of the effect. This also allows a decision about the clinical relevance of the results. If the error probability is given in advance, the size of the confidence interval depends on the data variability and the case number in the sample examined. 2. P-values are clearer than confidence intervals. It can be judged whether a value is greater or less than a previously specified limit. This allows a rapid decision as to whether a value is statistically significant or not. However, this type of diagnosis on site can be misleading as it can lead to clinical decisions solely based on statistics. 3. Hypothesis testing using a p-value is a binary yes or no decision. The reduction of statistical inferences, in other words, inductive inferences from a single sample to the total population, to this level may be simplistic. The simple distinction between significant and non-significant in isolation is not very reliable. For example, there is little difference between the evidence for p-values of 0.04 and of 0.06. Nevertheless, binary decisions based on these minor differences lead to converse decisions. For this reason, p-values must always be given completely. 4. When a point estimate is used, For example, differences in means or relative risk, an attempt is made to draw conclusions about the situation in the target population on the basis of only a single value for the sample. Even though this figure is the best possible approximation to the true value, it is not very probable that the values are exactly the same. In contrast, confidence intervals provide a range of possible plausible values for the target population, as well as the probability with which the range covers the real value. 5. In contrast to confidence intervals, p-values give the difference from a previously specified statistical level alpha. This facilitates the evaluation of a close result. 6. Statistical significance must be distinguished from medical relevance or biological importance. If the sample size is large enough, even very small differences may be statistically significant. On the other hand, even large differences may lead to non-significant results if the sample sizes are too small. However, the investigators should be more interested in the size of the differences in therapeutic effect between the two treatment groups in clinical studies, as this is what is important for successful treatment rather than whether the result is statistically significant or not. Keep in mind that there is no magic significance level that distinguishes between the studies that have a true effect and those that don't with 100% accuracy. The size of the confidence interval and the threshold for significance with p-values are based on convention in the field. There is no theoretical backing for the choice of 95% and 0.05. Confidence intervals, like p-values, provide us with a guide to help with the interpretation of research findings in the light of the effects of chance. There are, however, 3 important pitfalls in interpretation. First of all, we may examine the confidence interval and/or the p-value and observe that the difference is statistically significant. From this, we will usually conclude that there is a difference between the two treatments. However, just because we are unlikely to observe such a large difference simply by chance, this does not mean that it will not happen. Statistical significance is also sometimes misinterpreted as signifying an important result. This is the second important pitfall in interpretation. Significance testing simply asks whether the data produced in a study are compatible with the notion of no differences between the new and control interventions. Rejecting equivalence of the two interventions does not necessarily mean that we accept that there is an important difference between them. A large study may identify as statistically significant a fairly small difference. It is then quite a separate judgment to assess the clinical significance of this difference. In assessing the importance of significant results, it is the size of the effect, not just the size of the significance, that matters. A further error that we may make is to conclude from a non-significant finding that there is no effect, when in fact there is a real effect. Equating non-significance with no effect is a common misconception. A non-significant confidence interval simply tells us that the observed difference is consistent with there being no true difference between the two groups. Thus, we are unable to reject this possibility. This is where confidence intervals are much more helpful than simple p-values. The observed difference will also be compatible with a range of other effect sizes as described by the confidence interval. We are unable to reject these possibilities and must then assess whether some of them, usually the upper and lower limits of the confidence interval, might be important. Just because we have not found a significant treatment effect, it does not mean that there is no treatment effect to be found. The crucial question is, how carefully have we interpreted the findings? For all the complexity of chance and the interpretation of findings from clinical trials, another important consideration should not be forgotten. The findings from a given study relate to the patients included in that study. Even if an effect is assessed as probably real and large enough to be clinically important, a further question remains. How well are the findings applicable to other groups of patients, and do they particularize to a given individual? Neither confidence intervals nor p-values are much help in this judgment. Assessment of this external validity is made based on the patient's characteristics and on the setting and the conduct of the trial. This concludes the video.